Hello, welcome to Dr. RS channel. This is Dr. Riffat Sadiq, and today I'm going to talk a very interesting topic. Reading the label. Read the label. Which labels? You would ask me. Yes, the labels of the food items which we eat every day. We don't actually read the labels, we just eat it. But I'm going to tell you how important it is to read the labels. Everything is hidden in that little, they are so small sometimes I have to use my glasses. But for young people, you don't need the glasses. So read the labels and you start having habit of it. Because once you have a habit at an early age, trust me, it will be really good for the long term and you will be healthier when you are 80 years old. Because I have seen some of the patients, they are very, very conscientious. They actually read it. They will tell me this food is good, this food is not good. So reading the label is extremely important. So you will ask me that, many people say, oh, we don't have time to read the labels, or why should we bother? No, you should bother about this. What are you eating? What is in that? Sometime, they will say, oh, this much of the sugar, this much is fat, this much is carbohydrate, this much is sodium, potassium, magnesium. If you have a long, long, long list of ingredients, that is, you have to be very careful. Why the percentage DV, which is a daily value, why it is important? Okay, let's see that if I have if I'm eating a granola bar, for example, and on the top it say sodium is like 5% or 5 mg was sodium. But so it means that whatever sodium they are telling me, that is out of, if suppose my requirement of sodium is total is 3 milligram or 4 milligram or 5 milligram. So out of that, I'm already, the one granola bar has maybe 1 milligram or 2 milligram. So that is important. That tells you percentage of DV or daily value tells you that how much of the sodium is in that little piece of bar out of my total intake, which I am required to take total intake for that day. So it's very, very important you to know that even how to read the label. It's extremely important. So this is the daily value. So calories. So they, most of the time they actually put down in the list that this much is your calories. But you need to carefully look that what your requirement of calories are. Sometime when people are losing weight, like suppose their normal requirement of calories maybe 2000, but if they are on a weight loss mission and they have cut down their calories to 1500, so you need to do your own calculation that if this one bar had 100 calories, so that is out of your 1500 calories, this is one bar, I'm taking away like 100 calories. If you are eating a pizza slice, which might be 400 calories, so you need to watch your calories, you need to see what food item actually is fit for your calorie requirement. Sometimes you have little piece of chocolate and that's very caloric. So you need to have a calorie calculation all the time. And I think this is one of the best way to lose weight is calorie calculation. It's a simple, you just put put your goal. I'm 1500 calories. So whole day long, you just, nowadays it's you can have download an app in your phone and that will also help. You will put the food, it will give you the calorie, and at the end of the day it will total for you. So that's also important. Make a smart choices. In my earlier program also I said we need to be wise about what we eat. We have to compare. So when I said comparison, you need to compare. Okay, I have on the dinner table, if I'm sitting and I have two food items, one is a fried food which is full of calories, and the other one is healthier choice which has less fat, less saturated fat, less processed. That's not a processed food, or that doesn't have a lot of complex carbohydrate. So you need to actually make your own choice at that time. Trust me, that is very, very, I would say, important, and it's hard thing to do. It's not that easy to leave the most tasty thing on the table. There's a chocolate cake, strawberries on the top. Oh, I love it. But on the other hand, there's a salad. Imagine the choices. But even I tell people, don't starve yourself. Don't. Maybe you can take a bite. Just don't completely cut off, because you might rebound, and you might have a difficult time uh, to avoiding completely those food which are very tasty. So my grandma actually was my perfect, I would say, role model for me. She was like almost 100 years old when she passed away, and she had like maybe 70 pounds. She was like 5 feet 3 to 3 inches, and she was ranging from 100 to 100, maybe 100 pound, and she was perfect ideal weight. And what she would do, she would do little of everything. She would not, I never heard that she would not eat anything, but she would eat everything, but very little. If she wants to have a cake, she will have a one bite. If she want to have a bread, she will have a little bit of bread. So she would calculate. I was little and I would see her how she would calculate. At that time, she did not know about calories. She was not like into, but she had the sense of what is right, what is wrong. So we have to have a sense of our body, and we have to have a sense of or wisdom what we have to take in. So we have to be sensible about our body and health. If we don't have that, no matter what you hear, no matter how many people are preaching you, no matter how many people are telling you what to do, what not to do, it will not make sense to you until unless it comes from you, within you. So you need to really ask yourself where you want to be in 10 years. Do you want to have a diabetes? Do you want to have a hypertension? Do you want to be a big fat person? Or do you want to have a good vision? Do you want to have a good hearing? Do you want to have good memory? All these things are directly related to what we take in. Trust me, it's not an easy thing, but you need to talk to yourself. You need to make a decision on your own. We can give you all this information, but you need to really think, sit down, make goals for for yourself, and what is nutritional value of this food which I'm taking in, how much calories this food has that I'm taking in. Little things does matter. Little at a time. We cannot just do all at once. We have to do little at a time. Every day, one step towards your goal. So one thing at a time. Um, this we talked about the list, how important it is. Um, Always check the whole package. Um, sometimes they will say, yeah, on the top they will say calories in this, calories in this. But you need to pay attention on the serving. How many servings this pack has? So you need to see the whole pack. That's extremely important. Serving size. What is the serving size? 2 pieces of one serving, and that 2 pieces has how many calories? So you need to be a little bit detail oriented. Don't rush things. Um, so this is what I want you to talk to you today about, this labeling, what labels are, how the food labels are important, how the calorie count is important. But then at the end of the day, this can be one step in making up plans what you eat. So planning is extremely important for you. So maybe you need to sit down today, make a plan for yourself, and then follow little at a time, every day a little bit. And I hope this will be helpful for you. Thank you for watching.